Welcome to Hunter New England and Central Coast Primary Health Network. In acknowledgement of National Palliative Care Week, we have created a short video about what is palliative care. The video will include the roles of different health professionals, care options, and some common misconceptions so that you or your loved one can maximise your quality of life following the diagnosis of a life-limiting illness. We're joined here today by Dr. Ashwin Kaniah, a general practitioner in palliative care training. Welcome, Ashwin.
Thank you very much for having me.
We're very happy to have you. So our first question today is, what is palliative care?
Well, palliative care, my understanding of what palliative care is it's a holistic approach to looking after patients with often incurable or rapidly progressive diseases, focusing not just on the patient, but also on the people surrounding them in their life, as the people looking after them. It involves the medical aspects of looking after pain and other symptom burdens the patient's going through, but also the social and spiritual aspect of the holistic parts of their care. Moving on from palliative care, we can talk about end-of-life care, which is a separate part of palliative care, referring to when a patient's illness is in the rapidly progressive stage and they're entering the last days or weeks of life, which is a very nuanced aspect of palliative care itself.
So Ashwin, the next question is, why have you chosen to work in palliative care?
It's a very good question. I've had the fortune of doing numerous terms in palliative care and geriatric medicine as a hospital registrar over the years. And throughout my time in these terms, I've come to realize the importance of effective and clear communication when it comes to managing patients' expectations, not just around dying, but around how chronic and complex medical illnesses are actually looked after. Very often, as medical practitioners, we are taught to treat and how to save lives, but having the important discussions about what to expect when conditions can't be treated, that's a very gray area in medicine that not very many people have become accustomed to, and hence why I chose to enter palliative medicine as a specialty. I further more so learned the importance of ongoing communications around this area when I entered general practice training, whereby developing a therapeutic relationship and a trusting relationship with the patient to talk about what their expectations are on symptom management, but also their long-term aspects of their livelihood when it comes to incurable conditions.
That's great. So what are some of your aspirations in palliative care?
I love that question. So the long-term goal is, once I've completed training as a palliative care specialist, I'm hoping to be involved in advocacy for earlier palliative care involvement, not just in dementia care, but in chronic and complex case management. What I've found as a GP is GPs struggle with managing the nuts and bolts of palliative care and medication management in the community. And I'm hoping to advocate for cross-pollination and collaboration between palliative care and aged care and supporting GPs, not just in dementia care, but in palliative care in the community as a whole.
What are some of the misconceptions about palliative care?
Currently in my line of work in palliative care, the most common misconception I come across when I'm called to see consulted to see a patient is, does this mean that it's the end game for me, that all treatments are off the table, that is the end of the road? It's the most common misconception I come across, which very often is not the case. Palliative care, the current modern definition, includes supportive care, not just for patients at the tail end of their cancer journey, but for patients with numerous chronic health conditions, such as heart failure, chronic kidney disease, patients who are on dialysis needing supportive care, and dementia patients. And a patient who is on their cancer journey might require palliative care for symptom management at any point along their cancer journey, while still being looked after by their oncologist or specialist. So that's the first most common misconception. The other common misconception I come across is, what patients refer to end-of-life care. Oh, doctor, I'm not at the end of my life yet, but why am I here? And for a very pertinent example is cancer management. Lots of patients are on immunotherapy these days and live for much longer, but still need palliative care input for management of symptoms. We find that raising awareness and education reduces the stigma around the classical definition of what patients' perceptions are.
The next question is your approach to palliative care the same for everyone?
Another very good question. It's a two-pronged answer to that question. Whilst the basic medical assessment of pain and symptom burden tends to be formulaic from a clinical perspective, when it comes to the psychosocial aspects of a patient, that gives us insight into the person as a whole. I never assume anything about a patient's cultural or religious beliefs, sexual orientation, gender identity, or beliefs on dying. I like to ask patients an open-ended question, as in, what's of most importance to you at this point in your life? And this helps patients talk about the important people or partners in their lives, their thoughts on dying, their goals and values, sexual orientation and gender identity. And all of this helps me formulate an inclusive component of palliative care to support patients from the LGBTQI+ population, as well as culturally and linguistically diverse populations.
Great. Thank you so much for your time today, Ashwin.
Thanks very much for having me here. It's been a pleasure.
We're joined this morning by Kylie Hutchinson, and Kylie is a death doula. So thank you so much for joining us today, Kylie.
Thank you. Thank you for having me here.
It's our pleasure. So what is a death doula?
I get asked that a lot. Basically, I help support people at end of life with whatever it is they want to do at the end of life, helping them kind of like event planning at the end of life, completely non-medical, oftentimes talking between the medical team that I could not do my work without amazing palliative care, and working exactly with the people and finding exactly what that is that they want and helping them get that end of life plan down and hopefully achieve it.
Okay, so who do you support and work with?
I have a range of clients. Some of them are young, in their 40s, with life-limiting illnesses, and I've had others through to in their 90s. Some people just want some support. Some people want someone to talk to ask the awkward questions. Some people want to have some very deep and meaningful conversations about what's going to happen and what do we think is going to happen. But yeah, it's a lot of being and navigating one point of contact. This is where you can come to, and we'll work it out from here. And I don't know all the answers, but I promise I'll hold your hand and we'll get there together.
So what do you enjoy the most about your role?
I think it's the satisfaction that they got there and got what they wanted. Sometimes I enjoy being the reality check. It is great to just say, hey, there's this is the reality of what we're facing here, and everybody gets on the same page. Everybody realises where we're going. And it can be giving extended family, loved ones, some time that they maybe weren't really ready to face. And I can say, hey, no, we're here now. We've got to spend some time. And they get it. That's the thing that I really enjoy afterwards. They say, thank you for giving me that. Yeah.
So do you also work with the family after the person has died?
Yeah. So I've been a celebrant at funerals, and I do after death care as well with people, if that's what they want me to do. Yeah. But I always stay in touch with the families a little bit.
Can you tell us a bit more about after death care?
So after death care traditionally was done by families. We used to keep our loved ones at home, on a table. The family would have dinner around them and dress them and wash them, and then funeral companies took over and took that aside and said, we'll do it, which is where funeral parlours came into it. And that's beautiful, but on some level that has stopped our grief, and we haven't been able to process what is happening to our loved one, and we haven't had that time to sit with them. And some people still want it, and they want to wash their loved one and dress their loved one and spend some time with them and have a drink. You know, I've had brandy at 6 a.m. Okay, we're doing this now. But it's what happens, and it's beautiful. It's what the family wanted, and that's the memory that they do.
So what are some of the ways that you support people's wishes at end of life?
So I individualise my service to exactly what they need. I've been asked to do some after-death care. I've been asked to plan at-home funerals. I've been asked to build coffins. I've been asked to do a living wake. Some of it is facilitating conversations, some awkward conversations that they don't really want to. Some of it is just sitting with them and holding their hand and saying, you know, okay, you're here, this is where we're at, you're not going to be alone. Some of it is maybe working really hard to make sure that their pain is managed or whatever it is. So yeah, there's a range, and it's really up to the person, the individual, to tell me what it is they need, and I say as long as it's beautiful and legal, I'll do my best.
Okay, so what is a day in the life of a death doula look like then?
It's never the same. So I have some clients that I'm supporting at end of life who I might go out in the morning, take them to the shops if they want something like that. So that's one of my regular ones. I have another one that I assist with some showering and things like that. I've got others that I can take to appointments if they want someone to be in them and explain that medical terms are a whole other language all to themselves. So it could be that, and then possibly just visiting some clients in homes that I've, you know, just check in with them and see where they are, check in with some families. Yeah.
Thank you. You've provided such wonderful information. That was very insightful. And thanks so much for joining us today.
Oh, thank you for having me. I'm happy to have a talk about this all the time. It's a space where it needs a lot more information, and I'm happy to talk to people about it.
We're joined by Angela Martin, who is a nurse practitioner. Thanks so much for joining us, Angela.
Thanks for having me, Charles.
So what is the role of a nurse practitioner in palliative care, particularly in the aged care setting, as I know that's where you work?
Yes. So my role as a nurse practitioner in the aged care setting is about optimising the quality of life. It's about looking after their physical, their emotional, their cultural, their social side of things, and making sure that they are comfortable. How it comes about is when I go to the aged care facility, I'm given a referral, or it could be in a case conference, and I do a physical and comprehensive assessment, and then I work out in conjunction with the resident and the family what they need, what's worrying them, and we address that, and we put that all into a plan, and we work with the staff to put that plan in place. It's all about making the resident comfortable. I look after also the pain management side of things. Part of my role as a nurse practitioner is to refer on to appropriate other healthcare professionals, and also communicate and keep the general practitioner in the loop of what's happening with this patient. Also communicate, it's very important, communication with the families, the GP, the staff, provide education to the staff, and we just work as a really great team.
So what do you enjoy most about your role?
I really love being able to be part of the elderly's journey in their later stage of life. I enjoy communicating with the facility, with the families, with the staff, providing the education, making sure that the resident is comfortable, and just basically looking after their whole needs as a person and making sure that all comes together. And that takes teamwork, and I'm very privileged to have that within the facilities that I work with.
All right, so where can palliative care be given?
So palliative care can be given in the hospital, in the hospices, aged care facilities, and also at home. It's really important for everyone to understand that it can be given in the home, and that way that the palliative care team can come in, they can organise specific equipment that they need to make things easier for them. So any healthcare provider can provide palliative care services.
We hear a lot about advanced care planning. So why is advanced care planning important in palliative care?
It's extremely important, particularly in the aged care facility, that the advanced care planning is a routine care as a resident comes into the aged care facility. It's important that they express their wishes of what they want to happen in their last months, weeks, days of life. It can be very confronting conversation to have, particularly with the families. Usually the residents are quite coming to terms with the fact that this is what's going to happen, and it's the family. So we offer a lot of support, and it's really important that the family see that their loved ones' wishes are carried out and that they have a peaceful death. It's nothing worse than the loved ones seeing their family member have a traumatic death. And they just need to be peaceful and comfortable so they can go off on their next journey, and the family can reminisce and be comfortable in knowing that they've gone peacefully.
Thank you so much for all of that information. That was really interesting. So we really appreciate your time today, Angela.
Thank you. Thank you for having me.
Thank you to our speakers today. We hope the information in this video has been useful. For those seeking more information, the websites and organisations on the screen will provide you with additional resources. Thank you for watching.